made was with relation to a set of recommendations that came out of an HHS task force on what should be considered appropriate protocol for the detection of breast cancer. And a new recommendation came out from HHS which said that unless there was a history of breast cancer in the family, that women should not be required to get regular mammograms or self-exams until 50, and then they should do so every other year. And in my particular case, had I done that, I might not be sitting here, because I found my own lump 2 weeks after a completely clear mammogram. And had I waited a whole another 2 years to get one, who knows what would have happened. The reason I felt very strongly that I needed to make that statement, and I did in fact make it in a nonpartisan way on MSNBC as well as CNN and Fox, was because that task force is mentioned it may be as many as 2,000 times in this healthcare legislation. In other words, there is no question that the Department of Health and Human Services is going to have task forces which are going to determine what protocol is going forward. That is alarming to me, because in some cases, as was the case with this particular recommendation, the panel did not include appropriate experts. The panel did not include a radiologist. The panel did not include an oncologist. And what the panel was looking at was broad statistical data and making recommendations based on that data. In essence, what they were saying was, yes, it is true that the protocol of every other year maybe saved some lives, but it didn't save enough lives based on the cost. So they were making a cost-benefit trade-off in sort of macro statistical terms, and meanwhile, I think every life matters, and certainly if it's your life, you particularly think it matters. So I was alarmed then, and am alarmed now, by the fact of that task force and the Secretary of Health and Human Services making a series of decisions like that. Not to mention the fact that as a woman, I found the reasoning about why women shouldn't engage in self-exams, that it creates too much emotional trauma. I found that, frankly, sexist. I mean, women can deal with the emotional trauma of trying to understand what their health situation is. Now, to your point, there are today a whole set of government-run programs for health care, many of them associated, for example, with California's Medicaid and Medi-Cal programs, that deny or that prevent the denial of coverage for pre-existing conditions. There are a whole set of programs like that today. I mean, I have a list of them if you're interested. So the reality is there are government programs today that Californians are eligible for that do not permit denial of coverage for pre-existing conditions. And by the way, like many, many, many government bureaucracies, those programs don't work terribly well. I don't know the statistics on this, although there are people trying to gather them now. But I would guess that a portion of the people, of the 30 million people that are declared uninsured right now, that a portion of them are actually insurable, but are not being insured because they don't know government programs exist or they haven't gotten through those government programs yet. As a compassionate person, I can imagine the heartbreak, the anxiety of a mother who has a young child with a pre-existing condition and is struggling to find health care and health insurance for them. But you could deal with that problem far more effectively and far more cheaply than Obamacare does by either making sure that people are aware of the government programs that already exist, and or, if necessary, subsidizing insurance companies to deal with some of those conditions. Obamacare attempts to remake the entire healthcare system in 3,000 pages of legislation put together by a bunch of professional politicians who, frankly, in my opinion, don't even understand the healthcare system, much less are able to manage it, regulate it, and change it from stone to stone.